Clostridium tetani, otherwise known as tetanus, is an acute infectious disease caused by spores of the bacterium Clostridium tetani. So who can get tetanus? Well, anyone can get tetanus, but the disease is particularly common in newborn babies and pregnant women who have not been sufficiently immunized with tetanus toxoid-containing vaccines. The tetanus spores are found everywhere in the environment, particularly in soil, ash, intestinal tracts, feces of animals and humans, and on the surfaces of skin and rusty tools like nails, needles, and barbed wire. Being very resistant to heat and most antiseptics, the spores can survive for years. Neonatal tetanus occurs when non-sterile instruments are used to cut the umbilical cord or when the contaminated material is used to cover the umbilical stump. Deliveries carried out by people with unclean hands or contaminated surfaces are also risk factors. And a fun fact about tetanus cannot be transmitted from person to person.
Next is the pathogenesis of tetanus. The first step in pathogenesis is entry. Tetanus spores lying dormant in the environment enter the host through a wound or break in the skin. Neonatal tetanus occurs when tetanus endospores are present on the instruments used to cut the baby's umbilical cord. The baby is then infected with tetanus. Next is attachment. To attach, tetanus neurotoxin tetanospasm binds to glycolipids in the presynaptic membrane of the neuromuscular junction. After binding, tetanospasm is internalized and transported retroaxonally to the spinal cord. Tetanospasm blocks neurotransmitter release from the spinal inhibitory interneurons. After attaching to the host, Clostridium tetani must overcome the host defenses. Clostridium tetani overcomes the host defenses by producing endospores. Endospores remain dormant in harsh conditions such as extreme temperature, UV exposure, gamma exposure, and starvation. When the conditions are good again, the endospore germinates. Tetanus also avoids host defenses. It resides deep in wounds where anaerobic conditions exist, and there are few vacuoles to remove the Clostridium tetani. Next, the tetanus damages the host. Tetanospasm release interferes with the release of neurotransmitters and the blocking of inhibitory impulses. It interferes with the release of neurotransmitters by targeting a protein, called VAMP, that is needed for the release of neurotransmitters. It causes muscular contraction and spasms, seizures, and the autonomic nervous system can also be affected by the tetanospasm. Lastly, the tetanus must exit the host. Tetanus resides in the intestinal tracts of hosts. It is expelled from the host's body in the form of feces.
Next, we're going to talk about the clinical features of tetanus. Some common symptoms include spasms and stiffness in your jaw muscles, also known as lockjaw, difficulty swallowing, painful body spasms in the abdomen and neck, fever and sweating, high blood pressure, and a rapid heartbeat. Infants usually show the symptoms of being extra irritable, having muscle spasms, and lacking the ability to suck or take in liquids, which affects their nutrition.
Next, we're going to talk about treatment. There is no cure for tetanus. Tetanus is a medical emergency that usually requires care in the hospital. If injured, the person should have the booster shot within 48 hours of the injury. Cleaning the wound is essential to preventing the growth of tetanus spores. This involves removing dirt, foreign objects, and dead tissue from the wound. Aggressive wound care is important in treating tetanus. If the injured person hasn't had a tetanus shot in the past 5 years and the wound is deep or dirty, your doctor may recommend a booster. Antibiotics, given either orally or by injection, help fight the tetanus bacteria. Metronidazole is the drug of choice for tetanus because of its safety profile, efficient penetration into wounds and abscesses, and negligible central nervous system excitement. The usual dose of oral metronidazole is given in 4 divided doses of about 500 milligrams every 6 hours for 10 to 14 days. If a patient is allergic to metronidazole or has a hard time swallowing pills, they can take penicillin G to treat their tetanus infection. Immunization is the only effective prevention of tetanus. The vaccinations for tetanus include the DT, DTaP, TD, and Tdap vaccine. Infants and young children under the age of 7 receive the DTaP or DT vaccinations. DTaP vaccinations are given at ages 2 months, 4 months, 6 months, 15 to 18 months, and then again at 4 to 6 years. Preteens should get 1 dose of the Tdap vaccine to boost their immunity between 11 to 12 years of age. Older children and adults receive Tdap and TD. Any adult who has not had a tetanus vaccination within 10 years should get a single dose of Tdap. Pregnant women should get a Tdap vaccine during their 3rd trimester of every pregnancy to help protect the baby from whooping cough in their first few months of life. Mild side effects of Tdap may include pain, redness, or swelling in the arm where the shot was given, a mild fever, headache, tiredness, stomach upset, including nausea, vomiting, or diarrhea, muscle aches and pains, and swollen glands.
For the diagnosis of tetanus, doctors usually diagnose based on physical exams, medical and immunization histories, and signs and symptoms of muscle spasms and stiffness and pain. Laboratory tests are generally not helpful in diagnosing and confirming tetanus. However, rarely, serologic tests are used to test the serum antitoxin levels in the blood. Very low or undetectable anti-tetanus antibody levels would demonstrate a susceptibility to tetanus. However, tetanus can occur in the presence of protective levels of the antitoxin, so we can't use this test to conclude the presence of tetanus for sure in the humans.